And what I'd like to do is invite those of you that are in the audience right now to make sure that you're thinking about a question that you might like to ask to these great speakers we have with us here today. So tag pin your question. But also, we're very interested at the National Collaborating Center for Determinants of Health in collecting or thinking about or working with people who've actually successfully done things like that you've talked about there, Paul, really raising that issue of race-based data, of collecting it, of that concerted and analysis, but then taking it to the community for their perspective around what the solutions are, the validity of that, what it means, and the analysis done in partnership and in collaboration, and actually led by those folks that are in the community and in those neighborhoods. So I'm wondering if, as we're waiting for the question here, and I'm going to ask Claire O'Gorman when she sees a question to lift that up, but make sure you put some examples in there. Does anybody on the panel here like to respond to what each of you have said? So we'll just take a few minutes, and you can just put your hand up. I can see all three of you if you'd like to respond. Anjum, would you like to respond to what Paul and Lindsay had to say? Maybe build on it, and then we'll go to a question.
Absolutely. So I think I appreciate, Lindsay, you sharing the kind of policy entrepreneurship or the policy window kind of conversation, the three streams. So policy, politics, and problem. So I think right now the pandemic has opened this window where people are seeing what the problems are, right? And they were problems well before. These were all concerns for many communities well before, but now there's a broader consciousness raising, right? So we have the problem identification. We also have policy proposals. Again, communities have been saying for generations what needs to be done. And I think what we've really seen in this pandemic is the unlocking of the political stream, where politicians are hearing from their community members, their constituents, perhaps on a daily basis, like this is a problem, and also at the same time hearing the solution. So we're seeing, starting that what Paul was mentioning, that real galvanizing of community, and also people actually paying attention. So I think we're really seeing that kind of policy window open up because those three streams have been highlighted. And I think just to Paul's point, I think too often, and I come from a public health background as well, we focus a lot on the problem and the policy. We don't do enough on the politics. And I think it's a real opportunity now for us as folks in public health with that background in community health and different adjacent sectors, for us to start to get political, because that's how we're going to actually see the changes we want to see happen. I think it's not enough to document the issues any longer. It's not enough to also highlight the solutions. We need to get our hands dirty and actually get into that political work. And I think about that report that Dr. Teresa Tam raised. If we want to get to that resilient society and address the risks, we have to get political. So I think that's perhaps not always in our nature for a variety of reasons, but if we don't act, we're not going to get the solutions we need. And this window that has opened up over the last 12 months may shut down on us, right? So now's our moment, and I think we have to kind of leverage that moment right now, as Paul alluded to as well.
That's great. So Claire, do you have a question from the audience? I think there's a few that have come by, so I'll just let you maybe either synthesize or pull through some questions there, and then we'll get our speakers to answer them.
Yeah, there's a question from Samantha specifically for Lindsay, but I think all of our panelists could speak to it. We feel optimistic about these policy windows right now and the opportunity within public health to improve it and make a more substantial impact, but that the opposite might also happen, where people will use their frustration with pandemic response to justify cuts to healthcare and public health, potentially increase privatization. Kind of along with that, and another question that's come up is around, how do we continue to think of public health in a more expansive way? And so at a time that some people might advocate shrink that sector? How do we counteract that and expand that? So any thoughts on those comments?
Maybe I'll go to you first, Lindsay, and then to you, Paul, and then to you, Anjum. So go ahead, Lindsay.
Sure, thank you. That's a great question. Let me just first say that I'm really pleased to be here with Anjum and Paul, and I think I really appreciated your comments, and I think the three of us are very complementary, which can only be a good thing in this context. So I absolutely agree that this is an opportunity, and like we could blow it, and we don't want that to happen. And so I think the policy window concept is actually quite helpful, because it reminds us that there are these three pieces, as Anjum just very nicely articulated. So the problem, you know, there's a very obvious problem, but there's still opportunity for us to help define it, right? And so that it's not just about a virus. It's about, it's not just the element of equity and how this is played out is very prominent and needs to be part of the solution. So there's a role for us to play, I think, in helping to define the problem. In terms of the policy, so the viable solutions, I think it would be helpful if we could try to articulate sort of a coherent set of policy solutions. So it's not just one thing here and one thing there, kind of a piecemeal approach. It would be nice if we could have an overall vision, which I think is essential to addressing these things. And then I couldn't agree more with Anjum that we need to get much more engaged in the politics. And I mean, engagement in advocacy, I think, is still considered a competency for public health practitioners. And so I think there's not everyone is comfortable engaging sort of as an individual activist, and that's fine, but I think there's a way to find a way to engage as part of a collective. And so in my mind, that's exactly why the provincial, territorial, and national public health associations exist. I will just qualify that, though, with to say that some of the public health associations are very active and impactful. Some of them are less so. And an example of the latter is the Public Health Association in Alberta, where I'm situated, which really struggles. The membership is I think quite a bit lower than the number of people in the province who would identify as being part of public health. And having spent 4 years as the president of that organization, I don't fully understand why, but I think it has to do with some of the other challenges we're facing in public health. But we need to try to find some ways that allow us to engage as a collective. Maybe I'll leave it there for now.
Thank you, Lindsay. Those are some really, I think, important comments. And I just finished a term in June as the president of the Canadian Nurses Association, and advocacy and political action are part of their mandate, and they're very active in that space. And one of the things that I came to understand is, and Anjum, I think you spoke to the skill, it takes practice. So if you don't practice at all at it, it's like any muscle, it'll just not either develop or grow, or it'll get weak and kind of fade away. So it's not always our most comfortable thing to do, but I think that we all have a basic skill set in that. It is one of the categories in domains, actually, of the core competencies for public health in Canada, advocacy. And so practice is an important part of that. So stepping into it, and sometimes watching another, right? Go along and watch another, like you, Anjum, come along with you, and the virtual space gives us some opportunity to do that as we begin to develop our skills. So I'm going to turn to Paul and just see what he has to say in terms of answering that question. Thanks, Lindsay, and then we'll go to you, Anjum. Paul?
I think with response to Samantha's question, there's no doubt that I think the gains that we're all pushing for, whether it's high level in systems or on the ground in communities, have to be defended. We have to fight for them, and so I think to Anjum's point, this is why it's incredibly important that public health, broadly speaking, is political and is engaged and is connected to the communities that we are or they are serving. I think perhaps there's in my mind, I think there's an opportunity if we're listening closely to what community is saying and communities are asking for, to take very targeted and specific action on particular pieces. So I know that in the work that we're doing, we're lifting up advocacy to get anti-Black racism recognized as a public health crisis. We're lifting up work that's trying to get targeted and specific action around the structural and social determinants of health, but also things in chronic disease. We're doing that work, and I think public health is taking it up in some instances. So we're seeing, where, for example, some public health units across the country have said, yes, we're going to actually recognize that anti-Black racism is a public health crisis. And this is coming from communities. It's not being cooked up in, an office somewhere. Oftentimes it's folks engaging and listening to communities very, very closely. I think lastly, what I would say is, there is also an opportunity to look at maybe two things. One of my mentors, Camille Orridge, says we need to think about the health system, so not health care, but the health system as less of a sick care system and something that is about encouraging broader health and well-being, and really starting to frame and think about our work in that sense. And I think aligning public health with that kind of a message, aligning healthcare in the traditional format with this kind of message, forces folks out of the general responding to kind of whoever's coming through the door, or in public health, the latest emergent issue that we have to respond to it, and really taking responsibility to say, okay, what is happening out there? How do we connect to communities? How do we listen closely to what's happening and figure out not only how we respond urgently to urgent issues, but respond in that kind of mid and long-term way, so that we can actually address some of these issues at scale. Last thing is, there's a ton of, I think, great folks in public health doing work that we need to pay attention to and lift up. I'm trying to do this research and trying to engage, but so for example, in the race-based data space, I've heard Dr. Gaynor Watson-Creed is doing amazing work in that space. We need to pay attention to that, lift that up. And I think if we start to do some of those things, rethink the way that we think about healthcare and public health, and start to engage with communities more and listen more and engage more with that, take a more active role in that. And if we start to really think about, who are some of the shining stars in this space, and how do we lift up some of that work, there's perhaps an opportunity to not only continue to advance, some of what we're talking about here, but defend the gains, if you will. I'll leave it there.
Thanks, Paul. I really like your comment about lifting up those shining stars, right? And seeing where they are and almost like a hand on that elbow, helping lift up those voices and those people, because there are some incredible people and incredible work that's going on out there. So Anjum, maybe just a quick comment from you, and then Claire, I think we might have time for one more question, so I'll come to you in a minute. Anjum?
So I remember, when I first started in public health, when I was getting my master's in public health, I remember my friends asking me, what is public health? They were just confused. They didn't know what it was. Is it healthcare? Is it what? But, now I think about how much awareness there is for not only what public health is, but the importance of it, and also that equity lens. We have, perhaps in 100 years, never had this much spotlight on our field than ever before. So I think we as folks in this sector need to really take advantage of the spotlight. My goal would be, in a year from now, many residents across Canada would know what the social determinants of health are, right? Would know, all the key things that we know very easily. I want the public to know that. So if I was an academic, if I was a political scientist right now, I would actually maybe add another stream to that, political stream theory and add the public. And I think when it comes to the public, we as public health professionals, we have credibility. People, when they hear from us, they listen, right? And not only that, we have a potential platform that many others don't. So I think it would be incumbent upon us, while we have this spotlight, while we have this awareness, not only do some advocacy and public awareness raising around the social determinants of health and the key issues and equity, health equity in particular, but also use that as a tactic to let the public know why they should invest in us, right? Unfortunately, our sector is such that when we are effective, we're silent, people don't know we exist. But when there aren't investments in us, that's when we see the real trouble, right? So I think it is the challenge where, out of sight, out of mind. So let's make sure we're not out of sight, right? Let's make sure people are always hearing from us. And you might be like, Anjum, how do we do this? So I really think about two things. One, the importance of media relations. And the thing is, we have credibility. We can, when we put out information, ensure that it's evidence-based, but also put it out in a medium that people are listening to, reading, whether it's op-eds in the paper, radio interviews, podcasts. There's so many different ways that we can get our messages out there, whether stuff that our individual public health units or institutions have, or engaging with the more public publications and platforms. So that's one. Two, and I think this is to what Paul was mentioning, let's start to ensure that we're working with community, working with organizations, working with charities and nonprofits. I'd say, that would be an incredible partnership. Imagine if a local public health unit and a local civic leader, civic organization come together and talk about the impact of COVID-19 on a certain community, on a certain, set of issues. That would be powerful, because not only would you be having the ability to tap into your own audience, but tapping into new audiences as well. And for politicians, when they see that type of partnership, they start to ask questions. Oh, that's interesting. Let me read more about that issue. So it makes even the public health messaging more effective on both ends, or the advocacy messaging effective on both ends. So that's kind of my pitch. Let's add another stream to that political policy window theory and add the public. But also, I think, media relations and partnerships, that's how we're going to get that public awareness. So those are some of the things that I think could really take us from this awareness to action.
Thanks, Anjum. So Claire, is there a question there? And I think this will be our final round, and we'll get some good advice here. Is there a question?
Yeah, so there's been a couple of questions about how public health can navigate the politics and do that work. And I think our speakers have spoken to some of that and the role for public health moving forward and how we can be expansive on that. So thank you to those who submitted those questions. We have a really specific question here from Christian, and I think it's really relevant as we speak about partnering with community. So Christian asks, in your view, what may be effective ways for public health bodies and practitioners to engage public and members from historically oppressed communities in deliberative democratic processes to ensure that equity is integrated in the core of future approaches and that the grounds that we've gained aren't lost? So specific but big question there. Thanks for putting that in, Christian, and perhaps this can tie in with our closing remarks as we come on the hour here.
Yeah, I think that's a fabulous question, Christian. So we're talking, that we need to do this. We're talking that it's important to do it. We know that there's good outcomes when we do it, but really tapping into that how on the everyday. So I'm going to go back to our speakers for one more answer to that particular question, and then maybe just some wrapping or final words. And I think I'm going to come back to you, Anjum, and then I'm going to go Lindsay and then to Paul. So Anjum, you gave some really good advice there. Is there anything you want to add a little bit more concretely or tangible to Christian's question? And then what might be your final word to us for today?
Yeah, I think in terms of the question about vigilance, and I'm highlighting also what Paul has mentioned just around the importance of fighting for what we, so there isn't a rollback. I think the thing is, if we don't do it, the other side is doing it, right? So to the point around the fear of, are other people also, kind of taking over this policy window that's before us? There's an excellent book called The Shock Doctrine by Naomi Klein, and she talks about how, and also another book called Disaster Capitalism, but the whole idea that in times of crisis, someone wins, right? People are taking advantage of that moment. So I think it's important for us, if we don't, someone else will. And we want to do it for the goals of social determinants of health and health equity. So I think it's really important for us to get into that space. In terms of last words, I think public engagement and community engagement is going to be really, really pivotal. We have had a very siloed approach in the past, and I think there is this opening for new ways of doing things. So I think if we're able to be early adopters of that kind of way of kind of moving forward, that is probably going to be what is going to happen well after. That will be one of the legacies of this pandemic, I strongly believe. So I think we can be early adopters or we can be late adopters. So I think we know where we want to be in that kind of participation in that new trend that's kind of before us. So I'll end it there.
Thanks, Anjum. And we've seen some incredible examples where those silos have fallen and where we've seen a whole of government or an intersectoral and multi-sectoral approach to things, and it's happened, right? Where places where people would say that'll never happen. Well, there you have it. It's going on. So I really appreciate what you shared there. So Lindsay, in terms of that question of Christians kind of taking it right down at that action level, and then some final words.
Mm-hmm. So I certainly agree that that public health the pandemic has put public health in the spotlight, like all pandemics before it. But I guess I'm concerned that it's a very narrow version of public health that everybody is now thinking about. Like the general public, many people in the general public see public health as communicable disease control led by the healthcare system, and that's a very important part of public health, but it's not all of it. So I think that we have a big task in front of us in terms of advancing this vision with the social determinants of health, and that requires helping people to connect the dots, and people know, like, people viscerally experience the social determinants of health, but then they still connect health and healthcare, right? Like the two are conflated, and so I think that's actually a very important thing that we need to figure out how to decouple health and healthcare for people. It's hard for me to see how we can advance that, how we can advance this vision that we seem to all kind of agree on key elements of, without breaking down that conflation of health and healthcare. I do think that within public health, we have some work to do as well to get our house in order, so to speak. So one challenge, and again, I'm speaking as somebody who's an academic in this field, but there's a tension between the more applied and the scholarly and critical dimensions of public health. Like there's a tension that is very kind of prominent and problematic, and this I think is a challenge because it weakens our impact as a collective, and I just wish we could figure out a way to mobilize more effectively as a collective and find common ground. And so from that point of view, I think opportunities to bring the different parties in public health together are really important. And so this conversation series is one example. And is why I was pleased to be part of this as an academic, because I understand that many of the participants are practitioners. So that's great, a great opportunity. In my department at the University of Calgary, we have a public health journal club that brings together the practitioners, so the public health and preventive medicine residents, with population and public health graduate students. And these are two groups that are in the same department, but oddly rarely cross paths otherwise, which I just think is such a shame and a lost opportunity. So I think if we can, to me, these are kind of some of the foundational elements that we could work on, and it would be really a worthy effort of time in terms of advancing what we all see as a better outcome. Thanks.
Yeah, that's great. Thank you, Lindsay. And over to you, Paul. Just as I'm going to move to you and kind of give you some of the final moments of our conversation today, I'd like everybody, as they're listening to Paul, to put into the chat box one word that's kind of bubbling up for you right now, what's kind of coming into your mind, what you're hearing, and we'll make a wordle and introduce our next conversation in 2 weeks from that. So as Paul's speaking, so Paul, the one word that's coming into my mind is listening, and I think you used that word listening earlier. So how might you answer Christian's question?
I was going to reiterate the listening piece. I think oftentimes the people who are in opposition to you, people who are calling you out, can be your strongest allies in helping to address issues. I think what we've seen over this last little while is the ability for, again, those silos to break down and for people to become problem solvers, rather than like, this is not my zone, this is not my lane. How do we actually get this done? And bringing who's necessary, to tables, whether it's community folks or, again, public health folks, et cetera, to take that first step forward and build off that momentum. And for me, I think it's just been illuminating the way that's happened for me over the last couple of months. I would say as well, sometimes I think in public health, we need to not be so wedded to, I think, so something like the social determinants of health. People don't like it. If it doesn't land, then perhaps we need to change the way that we talk about that specific issue. Perhaps, like I think as Lindsay was saying, all of these issues really are tangible and visceral for folks in neighborhoods, in communities. Folks are feeling food security. Folks are feeling income insecurity. They're feeling, the growing gap between the rich and the poor. And I think intimately understand policy from that perspective. Perhaps we need to engage in those kinds of ways, in ways that engage and bring people in differently. I think, kind of moving to the final thoughts moment. I think as folks have said, folks are paying attention to public health and the necessity of public health in a way that perhaps folks haven't, at least for the short time I've been involved in this work. I haven't seen folks pay attention to public health in that kind of way. And I think we need to really think about the opportunities to start some work. So oftentimes it may be, again, back to the piece around those in opposition. It might be folks that are asking for a strategy. It might be folks that are asking for a response. Take that time to meet with folks, bring them into a room and see what, maybe the first step can be with those folks. Put communities in the position to lead their own, solutions, if you will. Sometimes it requires resources on the table. Sometimes it requires, again, creative problem solving. But I think with those partnerships, with that listening, with the type of flexibility, I think people will continue to see the importance of public health and really figure out the ways that we not only defend ourselves, but defend public health and the need for the work that we do here. I'll leave it there and thank you.
And that's just an excellent, I think, final words to a really, really excellent conversation. So I'm just going to thank Anjum and Lindsay and Paul for being with us today, for taking time out of your busy schedule. And I'm going to thank all of those participants that are putting words in the chat box and examples. And thanks to Claire and Jamie and Danielle for your great support today and an excellent conversation. We started and ended on time. So thank you, and we'll see you in 2 weeks at our next COVID conversation. Bye now.